Okay, so I'm hoping this is recording me all right. Kind of worked earlier in a test, so hopefully this part will be cut out anyways in editing. Anyhow, my face, right? Wow. Anyhow, I'm doing this video right now for a real simple reason, something that happened earlier this year. In July, mid-July, I got a sore throat, and by that itself is not much. I didn't even think anything of the time. I noticed my ears were popping a bit, and I went to bed thinking, oh, well, this will clear up tomorrow like it has done countless other times. The next morning I woke up and I had total deafness in this ear. Nothing. Couldn't hear tapping on the side of my head. Couldn't even hear tapping on my tooth. So I thought, geez, I better make an appointment for my doctor. Got into my doctor a couple days later, and he's like, well, you have an ear infection, and gave me some antibiotics and said, this will clear up in a month or two. If you're keeping track, it's about 6 months now. Seen the audiologist, and the hearing in this side is totally gone permanently. It wasn't bacterial, it was viral. It was in my inner ear. For the most part, that ear is perfect, except for the fact that the little tiny hairs that actually do the picking up of the sound and passing it to the nerve are destroyed by scarring from the virus. So what that means is that hearing is permanently gone. I've gotten into before a little bit about that, but people that have known my earlier videos on this channel have always been soft-spoken, and part of that had to do with the fact that I was a sonar operator and I had well above average hearing, so I always found myself as too loud, which meant my recorded videos always had me as too soft for the rest of the world. Well, this ear is gone now, and if on a plus note, if you can take a plus from it, is that my voice level or recording level seems to be a bit more agreeable with people. But in all seriousness, though, if you ever, not necessarily even just waking up, if you ever find yourself in a situation where you have a total hearing loss, you can't hear anything. Now, you might hear something if you plug your ear, but in my case, I didn't even hear that. But you might hear something if you plug your ear, a little bit muffled or whatever. But if you still have a complete loss, suddenly especially, that's an emergency situation. You need to get to whatever you have locally for emergency. I wasn't aware of this at the time, obviously. Just about everybody I've talked to personally that I know in my daily travels in the last little while has no idea that was and is considered an ear emergency and should have been taken directly to an emergency, as in an emergency room. There's specifically here a place for ear emergencies, which again, at the time I didn't know, and most people that I encounter today don't know. Part of the reason why I'm making this video is that it needs to be treated like pretty much you just cut your thumb off. Because you have a very narrow window within 24 to 48 hours that simple treatment might halt or stop or allow you to repair the tiny bit of damage that's happened. So you've got a very narrow window of 24 to 48 hours where there's a very high success rate. Obviously that window expired on me very quickly. The whole point of this video, and I'm trying not to take it too dark here, is that this doesn't need to happen to anybody else I know. It's a couple reasons why you can have sudden hearing loss. One is they have no idea what causes it. Some people just wake up and it's gone. In my case, it's an infection got into the inner ear, and the other is exposure to loud sounds, and that's pretty straightforward. I mean, you're going to know when it happens, but a virus and infection is a little harder to detect because you might not even have symptoms that you would feel until after. And in my case, I didn't even feel the vertigo that was associated with the labyrinthitis that kicked in later until 2 days after I even seen the doctor. So that's quite a few days after the fact that I couldn't even hear. So I guess the main point is, if your hearing stops, and I mean stops, you just have it one evening, go to bed, wake up the next morning, and it's gone, and you think to yourself, well, this might clear. Seriously, if you give yourself, maybe a couple hours and do the usual, thinking this is my usual ear, it'll just pop and be cleared in a minute. If it doesn't, do yourself a favor. Don't end up like my ear. There's no need to be tough. There's no winning in being tough or thinking that, it'll just fix itself. It's done all the other times before. But if it's different and it's truly not hearing anything, that's a hearing emergency. You need to have it looked at, and saving your hearing could be as simple as a small injection of steroids or a pill. There's most likely a steroid, if I remember. It could be that simple. And yeah, you'll probably end up getting sick and all that junk that would follow along with it. But the difference is when you come through the end of it, you may still have most, if not all, of your hearing, or at least some of it that you would have lost anyways, and at least known that you made the attempt, or at least got some help. In my case, that was pure ignorance. Had no idea that that was a thing. And anyhow, so takeaway for this is loss of hearing, especially total loss of hearing very quickly, is an emergency, and it needs to be looked at by an appropriate healthcare provider, and waiting for your family doctor is too long. You need to go to emergency, and I can guarantee you from the hearing professionals that I've talked to said they'd much rather send somebody away with a pat on the back and tell them it's just a cold, yours will be fine, or you have a buildup of earwax, let's get it cleaned out. They would much rather have to deal with that than see someone like me quite a while later and know that there's nothing they can do about it. Anyhow, I may talk some more on this later, but as far as how things were going, I wanted to get this out today, and I'm kind of at a point where I could talk about this again today. And yes, I do hear the microwave beeping in the background. I just can't hear anything in that direction at all. My right ear is gone unless you're playing a kick drum 3 feet away from me or something like that. Everything else above that is literally gone. So in my case, there isn't even a hearing aid that will let me hear on this ear. I have some projects coming up I might share with you guys in a couple months, because I have some parts on order that are going to be related to this and could be interesting. And looking into something called the Open Hearing Aid Project, but in my case there's no hearing aid in this ear that's going to make this ear work so far as we can tell. Just something called a cross, which is a microphone here that plays the sound this ear would have heard to this ear, so at least I'm not totally sound blind over here, for lack of a better term. Anyhow, not the usual chipper upbeat video, so if you were expecting that, I'm sorry. But if this video even helps one person not lose their hearing, then for me it's worth it. So as always, thanks for watching. Stay safe, look after your hearing and your sight. There's no heroes, there's no macho bravo winners if you're just doing something quickly. It's not worth it. Anyhow, as always, thanks for watching, and I'll catch you in the next video, and I promise it'll be more upbeat. Thanks, bye.